Hi all, I'm Grace. I'm a policy coordinator at Healthcare for All, and I'm here to bring you the first ever HCFA vlog. Let's get into it. Last week, President Biden signed the Inflation Reduction Act into law. If that sounds like a big deal, it's because it is a big deal. The IRA makes massive investments in deficit reduction and reducing carbon emissions. But as a healthcare advocate, I'm here to talk about the IRA because of the significant progress it makes towards accomplishing the administration's health policy agenda. In fact, the progress is so significant that I wanted to spend the next 3 minutes breaking down the key pieces of the law as part of HCFA's very first vlog entry. 3 major provisions stand out within the IRA. The first is that this law will lower prescription drug prices by allowing the federal government to negotiate with drug manufacturers to lower prices under Medicare. Healthcare advocates have been after this policy achievement for a long time, like decades long. But finally, starting in 2026, 10 of the most expensive drugs will be chosen for negotiations. Additional medications will be negotiated in subsequent years. If all goes according to plan, these negotiations will drive market prices down for each drug, meaning lower drug costs for Medicare enrollees. Projections have shown that by 2036, this policy will have saved the federal government $100 billion. The second significant healthcare win within the IRA is the capping of insulin prices. The cost of insulin in the US is 10 times higher than the average of all other countries combined. 1/4 of diabetics have skipped rent or mortgage payment just so they can afford their insulin. This might be a hot take, but I think that life-saving medication like insulin should be affordable for those who need it. Fortunately, the IRA includes a $35 a month insulin price cap for Medicare recipients. Last but certainly not least, the IRA includes provisions to extend enhanced premium tax credits. Without these tax credits, over 13 million people would have seen a 50% increase in their healthcare premiums. In Massachusetts, we're lucky to already have these tax credits in place. This means the state government will accrue additional savings to be used on future healthcare initiatives, such as the expansion of the Connector Care program. So yeah, like I said, the passage of the IRA is a big deal, and the fact is, one video isn't enough to review everything in this new law. If you would like to learn more, I wrote a blog entry on HCFA's website that goes into even more detail on this topic. The link is included in this post. Thanks for joining me on the first ever HCFA vlog, and stay tuned for more.